Post-operative instructions following dental implant surgery. After dental implant surgery, it is important to carefully follow all post-operative instructions and take all medications as instructed. After a dental implant has been placed, in most cases, there will be a small metal cylinder, healing abutment, protruding through the gums. There may also be sutures. Take care not to disturb these. It is very important to take your antibiotics and use your prescription mouth rinse starting the day of surgery. If you did not receive these prescriptions, please call our office immediately. On rare occasion, the small metal cylinder, healing abutment, may loosen. The dental implant itself is generally fine, but it is important not to swallow the healing abutment. Save the healing abutment. It is not an emergency, but give our office a call, and you will be further instructed. Do keep the area clean by gently rinsing frequently if the healing abutment has come off. Bleeding. Slight bleeding and redness in the saliva are common after dental implant placement. If there is excess bleeding, gently wipe any old clots from the mouth, and then place clean new gauze over the area and bite firmly for 30 to 40 minutes. Repeat every 30 to 40 minutes with new gauze. If excessive bleeding continues, bite on a cold water moistened tea bag firmly for 30 to 40 minutes. Slowly remove the tea bag and leave the area alone. If there is continued excessive bleeding, call our office for further instructions. Avoid excessive talking, drinking from a straw, or excessive chewing. Swelling. Swelling is normal after any surgical procedure, including the placement of dental implants. Swelling around the mouth, jaws, cheeks, and below the eyes is not uncommon. The swelling will usually reach its maximum 2 to 3 days after the placement of the dental implants. The swelling can be decreased by the immediate use of ice packs in the first 48 hours. Ice packs should be applied to the outside next to where the dental implant surgery was performed. Keep the ice on as continuously as possible. Also, sitting upright and not lying flat on the first day will help to decrease the amount of swelling. You may have been prescribed other anti-inflammatory medications, such as dexamethasone, Decadron. If you were prescribed these medications, follow the instructions written on the bottle. Pain. Pain medications are normally required after dental implant surgery. If you can take ibuprofen, Motrin, or Advil, take 400 to 800 milligrams every 6 to 8 hours or as prescribed by your doctor. If you cannot take ibuprofen, then 1 to 2 tablets of acetaminophen, regular Tylenol, 325 to 650 milligrams should be taken every 4 to 6 hours. If you are prescribed a stronger pain medication such as Norco, hydrocodone with acetaminophen, Tylenol with codeine, or Percocet, oxycodone with acetaminophen, you can take that in addition to your ibuprofen if the pain is severe. But do not combine Norco, Tylenol with codeine, or Percocet with any medication containing acetaminophen, Tylenol. Follow the directions written on your prescription bottle. If you do take any of these medications, do not drive or work around machinery. Also avoid alcohol while taking these medications. Oral hygiene. Gentle rinsing should begin the day of dental implant surgery. Follow the instructions on your prescription mouth rinse. You can brush your teeth the day after your dental implant surgery, but be careful not to traumatize the area where the surgery was performed. Diet. If you had IV sedation or general anesthesia for your dental implant placement, liquids should be taken initially. Your diet can then progress to more solids as tolerated. However, take special care to not chew directly on the implant site until directed otherwise. Nausea and vomiting. After IV sedation or general anesthesia, some patients may feel nauseated and vomit. To help avoid this problem, do not take your medications on an empty stomach. Take sips of clear carbonated liquids, such as ginger ale or 7-Up. Hold off on your medications, if possible, until the nausea subsides. If you have continued nausea and vomiting, call our office for further instructions. Bruising and jaw tightness. Bruising or discoloration around the areas of surgery is normal and can take several days to subside. Jaw tightness is also common and will improve and resolve over time. Dizziness or lightheadedness. After IV sedation or general anesthesia, some patients may feel dizzy when standing up. Always have someone watching you for the first 24 hours after sedation. Do not get up quickly from a lying or sitting position, and make sure to remain hydrated with fluids. Smoking. To ensure the best post-operative recovery, refrain from smoking for as long as possible after dental implant surgery.